I'm a 39-year-old male and finally ready to admit there's an issue. I've been noticing a lot of blood on the toilet paper lately, and I think it's starting to affect me. What do you recommend? My girlfriend and I are active, and she hasn't noticed any issues. I'm not sure what I'm doing wrong. We buy soft toilet paper, and I always wipe until there are no stains. Some days it's fine, but most days it seems like someone spilled red drink onto the paper. I don't feel like I'm doing anything excessive, but maybe I am being too rough? I'm open to switching to wipes but don't know what to do. There's never blood in the toilet bowl. My friend with ulcerative colitis said that's how he first noticed his condition. Any advice would be greatly appreciated. Edit. Thank you everyone for your help. We have another gig tonight, so I'll be unavailable until tomorrow. If you like fish, you might enjoy us. We're called Glass Pony. This issue even made me late for load-in yesterday. Story 1. See a doctor at once. Significant amounts of blood can indicate anything from a minor problem to a life-threatening condition. The sooner you find out what it is, the more likely it is that the problem will not be fatal. At once means you should have an appointment at the first available opportunity. For example, booking an appointment on Monday morning. Do not delay for a week or two before taking action. If you cannot get an appointment booked on Monday, call the medical advice line for guidance. This message is approved by my brother, who survived colon cancer by following this advice. He was about the same age as you when diagnosed. Is it likely to be serious? No, but do not ignore symptoms like these just in case it is. If you do not have a bidet, use a shower afterward instead of wiping too hard. It is a minor inconvenience to undress your lower half completely and detach the shower head from the wall. Story 2. Just because there is no blood in the bowl does not mean you do not potentially have colitis. I was diagnosed with ulcerative colitis in 2016 and have only noticed blood in the toilet bowl a few times. The rest of the time, it was only on the toilet paper. You might not have colitis, but your reasoning is not accurate. Get checked by a gastroenterologist. Story 3. It is possible that you have hemorrhoids, but if you are experiencing other symptoms, you may have had or developed an internal fissure, which requires medical attention. Make an appointment with a doctor, especially if you are in your early middle years. This should not be ignored. Consider factors such as diet, stool consistency, constipation, presence of black color in your stool, and general lifestyle habits. It might be helpful to take fiber supplements to make your stool smoother while your body is healing, but be sure to get a proper evaluation. This condition is not something to take lightly. In the best case, you will overcome any embarrassment about seeing a doctor and receive good news and a clean bill of health. Story 4. Wow, buddy, you've been wiping for many years now. I don't think you randomly started waking up one day and wiping too hard from then on. It has to be something with your internal plumbing. There could be several reasons why blood is coming out. I recommend scheduling an appointment with a doctor. In the meantime, start documenting when it happens, what time of day, after which meals, how much bleeding occurs, and so on. I hope this helps. Good luck solving your issue. I'm sure it's not a problem if you address it properly. If you don't try to solve the root cause, don't expect any changes. Wipes and a bidet might help, but that's just treating a wound that's too big. You can do this. Relax and try to talk with a doctor. Story 5. There are many reasons for blood on the toilet paper. Some are easy to fix, while others are serious medical conditions. The answer is a physical examination. Please see a healthcare professional. Story 6. Just wiping too hard, probably. Try wiping with regular tissue to remove some materials, then use wet wipes for the stubborn residue. Alternatively, get a bidet. Everyone I know who has one has seen the benefits. Edit. Do not flush wet wipes. Story 7. See a doctor. It may be something simple, but it could also indicate the need for immediate care. Hemorrhoids are a possibility, as is an anal fissure, which is a cut just inside the sphincter. Preparation H suppositories help with itching and healing for both conditions quite well. Melt the suppository a bit in your hands before inserting. Do not insert it dry. Story 8. How thorough is she in her investigations? It sounds like a pile somewhere is having a bad time when you are pushing hard. Story 9. Physician. If you have discomfort when passing stool followed by bleeding, it is likely a fissure that heals by avoiding any hard or constipated stools. Preparation H can help. There are two types of hemorrhoids: external hemorrhoids, which are usually painful and visible using a mirror, and internal hemorrhoids, which are painless and only seen when bearing down but recede inside the external sphincter at rest. Again, use stool softeners, preparation H, and sitz baths, which involve sitting and soaking the anus in a basin or bath of hot water with Epsom salts. If these simple methods do not help, you should see a physician. Story 10. Wash instead of wiping. If it continues, get yourself checked to rule out health conditions. I am a nurse, and colorectal surgeons always advise patients to wash after every bowel movement instead of using wipes or toilet paper. Story 11. Try using wet wipes or baby wipes. I have used them all my life. I promise you will feel much cleaner, and the moisture means there is very little friction on your skin. Story 12. At age 39, it is time to get a colonoscopy. Go get a colonoscopy. This could be nothing or something serious. You will only be a few years older for your first colonoscopy, and the recommendations for the age to start are decreasing. Story 13. You have probably got hemorrhoids. I talked to my doctor about it early and was told they are harmless unless they are causing pain. Regardless of some blood when wiping or going to the bathroom, definitely see a doctor to confirm. Story 14. I am prone to hemorrhoids, so I wet my toilet paper. It has more or less solved the issue for me. Story 15. Is your diet unhealthy? After I eat very greasy food, I tend to have painful bowel movements. I cannot eat Popeyes, for example, because it really affects me negatively. Story 16. I have one of those sprayers that hooks up to your toilet. It is definitely a game changer. Also, you are actually supposed to dab as opposed to wipe. That is just a regular thumbs up, not any insinuation. Story 17. I find that if I am wiping too hard, it means that I and some of the rest of the raid need to invest time preparing for the encounter, even if that means grinding gear and enchantments. Story 18. You might have hemorrhoids. If it is a friction issue, consider getting a bidet or baby wipes the next time you go grocery shopping. Story 19. Use a bidet as recommended. Alternatively, wipe gently with basic toilet paper and follow up with flushable wipes. Story 20. Do not use cheap toilet paper. If you are wiping until your skin is raw and bleeding, then you are overdoing it. Try wiping with toilet paper once or twice, then use a wet wipe. Story 21. Go see a gastroenterologist. It may involve lubrication and the doctor inserting 2 fingers to check for hemorrhoids. I used to take over-the-counter Nexium daily even though it says to use for only 14 days. The doctor prescribed me a 40-milligram version a month ago, and I have not seen any blood on my toilet paper after a bowel movement. I also reduced my intake to 1 C4 energy drink per day instead of coffee. I consume about 3/4 of a can on weekdays only and pour out the remainder. The doctor is still recommending I get a colonoscopy because I am turning 44, and 45 is the recommended age to get your first. Story 22. You should not have to wipe that hard. It has to be something you are or are not eating. You have to lubricate the system. Grooming could also help. Story 23. The fact that not everyone in the world who can spare $30 has a bidet is insanity. It makes your life better, saves money, improves intimacy, and is very easy to install. Story 24. Get some wet wipes. It sounds like it is just irritation from over-wiping, so wet wipes should cure that completely. Story 25. Consider getting a bidet, but also evaluate your diet. If you need to wipe frequently due to messiness, you probably need more fiber in your diet. Look into fiber supplements, fiber-rich snacks, and high-fiber foods. Story 26. Get checked out by a doctor. I sometimes have to work hard with the cheap paper there, and I might get chapped, but I do not bleed. Also, as others have said, try a bidet or wet wipes. Before Christ. Story 27. Trim down on your fiber intake too. It is great to have a smooth bowel movement with no need to strain or wipe. Story 28. This might be the cue for you to go to a doctor or hospital at the earliest convenience. Unless you are wiping very roughly, it is unlikely that a significant amount of blood is coming out, especially if you are aware of it. Story 29. Bro, by Flushable Wet Wipes. I made the switch a year ago and haven't looked back. They are soft and moist, so really comfortable and do a better job of cleaning too. Story 31. Are you taking any medications that will thin your blood, such as ibuprofen or other nonsteroidal anti-inflammatory drugs? 2. Are you consuming high iron supplements? 3. Use a bidet or wet wipes for the final cleanup. Story 31. If you cannot get a bidet like others have suggested, try using flushable wipes. Note that not all plumbing systems can handle them, so do your own research. Story 32. Drink more water, 2.5 liters if your weight is approximately 80 kilograms. In my experience, it helps significantly with the smearing issue. Story 33. Very late in life, I finally figured out the proper way to wipe, at least for me. The first wipe, reaching around behind, pushes down from the anus towards the scrotum. The second, third, and subsequent wipes are in the opposite direction, pulling up from between the scrotum and anus to just beyond the anus. Previously, I had only done the push-down motion and could never get a good wipe. There was always some feces on the toilet paper. Story 34. You have hemorrhoids. Go to the doctor before they get worse and you lose a lot of blood. Or just wait until you start passing out, I guess. After that, get a bidet, you'll love it. Anyone who hasn't used one doesn't know how nice a clean butt feels. Story 35. You could have an anal fissure. It is a tear inside the rectum. I would recommend seeing a doctor, but if you drink enough water, get enough fiber, and do not strain when you go, it might heal on its own. Story 36. That was happening to me. Go see a doctor. You might have a hemorrhoid that does not hurt but bleeds occasionally. Story 37. 40F. I don't think it is your wiping. Most likely, you sometimes have hard stool that is causing abrasions as you poop. That is why your girlfriend cannot feel anything by touch. The issue is inside. Here are 2 options. 1. Review your diet and lifestyle. How is your water and fiber intake? The majority of Americans are fiber deficient, and laxative dependency is increasing rapidly. 2. Sometimes there is a medical reason and a doctor can help you. You should not be bleeding. Story 38. As a girl with this problem, get a good fatty cream. I use Hamidum, although I am not sure if it is available where you are. I only use it on the bad days when it starts to hurt. Also, wash up after every bowel movement. Literally, take a cloth and soap and wash it or it will get worse. You also risk getting an abscess, and as someone who has had one, you do not want that. So keep it clean, and then apply cream to moisturize. Story 39. I bought a bidet during the pandemic and my life has never been better. The cleanest bottom at all times. No rough scraping, just a blissful refresh of the anal area. Then you dab it dry. Get a bidet. It will change your life. Story 40. That is serious. I would recommend a colonoscopy. Bleeding is never a good sign. It is not the patient's fault. Story 41. It could be several things. You might be wiping too much and causing irritation. Do you feel pain when you wipe? You could also have hemorrhoids. They are not always external or obvious. They can be just inside and bleed after bowel movements due to pressure and friction. Could be ulcerative colitis. If you switch to wet wipes and still experience bleeding, it is likely not caused by wiping. You will not know for sure unless you get examined by a healthcare professional. Story 42. Same issue for many years. Thought it was drinking, but it was not. You can see a doctor. If you have hemorrhoids and push it all, it can cause bleeding and look like a serious injury. They can burn them off and then it is all gone. Not feeling any pain. Story 43. I think you need to go to a doctor seriously. There is no way that you are wiping so hard that you regularly see blood. That is not normal. Please do not take this lightly or put it off. If your appointment goes well, then you will know to wipe softer, use wipes, use a bidet, or follow whatever other commenters are suggesting. Story 44. If there is a lot of blood and you are concerned, you need to see a doctor. You will probably need a referral from your primary care physician if you are in the United States to see a specialist. It could be a gastroenterologist or a proctologist. If it is just occasional bleeding and not continuous dripping, I would recommend using a bidet. As someone who was in a similar situation, this is how I was diagnosed with irritable bowel syndrome and switched to using a bidet because I was having bowel movements around 5 times a day, and the area was becoming raw. Story 45. I cannot comprehend using toilet paper to clean after using the bathroom. It makes no sense to me. You can get a bidet. They even have advanced models with heated water, but a regular one works fine. You can use wet wipes. I prefer body wipes designed specifically for skin, which are sanitizing but not irritating. Just stop using toilet paper. Story 46. It's unlikely to be wiping too hard unless there is already an issue or you are using sandpaper instead of toilet paper. If it were an external abrasion, then you would almost certainly see blood elsewhere, like on the inside of your underwear. If the blood is fresh, it is most likely an internal hemorrhoid, though it could be something more serious like bowel cancer, so get it checked by a doctor. Story 47. Get a bidet and add fiber to your diet, perhaps by drinking a fiber supplement daily. These 2 changes to your routine will help you have regular bowel movements even when you travel. However, be cautious and see a doctor about the bleeding. Story 48. Baby wipes. Do most of your cleaning with toilet paper, then finish lightly with wipes. Do not flush wipes, even those labeled flushable. Story 49. You could have a hemorrhoid. This is not medical advice, but they are common and can cause significant bleeding. I would only be concerned if your actual stool contained blood that is black and tarry. Story 50. I am saying this as a doctor who works in the emergency room. If plain old toilet paper is injuring your skin, the problem is not the brand. Something else is going on, and trust me, some of the possibilities are not the kind you want online forums diagnosing. Go see your doctor. Story 51. It sounds like your wiping is fine, but you may be breaking the skin due to the size or hardness of what comes out. Otherwise, consult a doctor. Story 52. Eat more fiber and get a bidet. Also, see your primary care provider who will probably refer you to a gastroenterologist. This could be a number of things, but what is mentioned above will hopefully help a little. It is not a replacement for finding out what is causing it. To put things in perspective, you could have colon cancer or internal hemorrhoids leading to bleeding, but you cannot really tell unless a healthcare provider assesses you. Story 53. Could be Crohn's disease. Document the blood and take pictures of the stool. See a general practitioner who will hopefully arrange a colonoscopy. I am not a doctor, and this is not a diagnosis. Story 54. Increase your fiber intake. Consult a doctor. Use wet wipes and creams. The skin is thin and sensitive. Treat it gently. Story 55. Use one of those handheld spray devices like they have in Asian countries. Then use 1 or 2 toilet paper wipes to finish the job. Story 56. You need to see a gastroenterologist as soon as possible. Wiping hard should not cause this much blood. Anytime you see blood on the toilet paper, you need to see a doctor immediately. Story 57. Wet wipes are great for travel, and a bidet is ideal for home. Shaving or at least trimming that area can significantly reduce how much you need to wipe. Story 58. I have suffered with this. I find that shaving the hair off helps because there is less hair to clump and potentially cause microtears. I also find there is a certain area where the pulling motion from wiping probably causes the skin to break, so I use wipes if I need to wipe more than 3 times. I was checked by a doctor who said it was nothing serious. Story 59. Firstly, get a colonoscopy as soon as possible. I was diagnosed with stage 3 bowel cancer at 39, so you do not want to delay. Secondly, for wiping, I recommend getting a pump tub of eczema cream and putting a blueberry-sized dollop on your toilet paper for the first wipe. It helps to moisturize the area and allows you to clean without irritation. Story 60. Consider getting a hot and cold water bidet. You do not need fancy electronics. Just get the hot water from the valve under the sink and cold water from the toilet. I call it the shovel. Story 61. Stop eating wheat and sugar. Use a squatty potty step stool and a handheld portable bidet by Tushy, and you may never need to wipe again. Only very recently in human history have we used toilet paper. It was not invented until 1857. Previously, people used leaves, grass, moss, and sea sponges on sticks. Sitting while pooping is also fairly recent. Squatting engages the proper muscles, fully evacuates the bowels, and helps the orifice close naturally. Story 62. I have not used toilet paper in nearly 2 decades since I first moved out of the United States of America. I use a sprayer and wipes. Story 63. See a colorectal doctor. This could be a fissure or hemorrhoid that may require surgery. If it is, I would review your diet with your general practitioner to determine if your body might be reacting to something. Also, definitely get a bidet. Story 64. If you are wiping that hard, wouldn't you also be tearing the toilet paper? What is your diet like? Because that does have an effect on your bowel movements. Lastly, go to the doctor and explain this because it might be something more serious. Story 65. Given your age, the most likely cause is hemorrhoids, which is not great but not life-threatening either. I agree that you should see a doctor in any case, but personally, I would not be too scared. It is far more likely to be hemorrhoids than something more serious. To be clear, I do not have any medical training, which is why you should see your family doctor and trust their opinion, not mine. This said, 1. If it is hemorrhoids, diet would be the main way to keep the issue under control, but again, see a doctor and follow their advice. 2. Regardless of the issue regarding wiping, I suggest you install a Japanese toilet, electronic bidet, or washlet. There are many names for these devices. Basically, it is a very fancy toilet seat whose main function is to spray water directly after you finish. I tried it for the first time in Japan, and in my humble opinion, it is amazing. Also, I vaguely remember it could help with hemorrhoids, but I am not completely sure. The main advantage compared to a bidet is that you do not need to install a new appliance in your bathroom. You just need to replace the toilet seat. Story 66. Like many others have said, buy a bidet. I had the same problem, so I bought one. It takes a couple of tries to find the right angle and technique to avoid wiping anymore, but it is 100% worth it. I fill up the container twice with water, use a bit of toilet paper to dry, and then I am done 95% of the time. Sometimes I do have to wipe, but that is really rare. Story 67. I do not have a bidet, so I gently wipe with regular paper first, and then I use flushable wipes to finish. It works wonders. Story 68. This is probably just an internal hemorrhoid, but that is why doctors exist. Definitely get this checked out. It is not caused by your toilet paper. Story 69. You need to see a gastroenterologist without any excuses. I am 40 years old and had a colonoscopy performed for the same issue you were experiencing. Story 70. Wipes will roll with the waste and block your drains, with a drain cleaning company charging you $500 to clear it. Maybe see the general practitioner, as you should not be bleeding from the rectum. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.